Efficacy of manual therapy in TMJ joint disorders and its medium and long-term effects on pain and maximum mouth opening, a systematic review and meta-analysis. Background. TMJ consists of two synovial joints that work together. However, this unique trait presents certain problems. Main musculoskeletal cause of orofacial pain affecting 25% of the adult population. Females are more affected rather than males with a ratio of 1.5 to 2.5 times. TMD has various causes, including articular problems, displaced disc, hypermobility syndrome, and muscle issues. Pain is a significant outcome of TMD, impacting function and quality of life. Treatment includes splints, psychotherapy, acupuncture, physiotherapy, TENS, massage, joint mobilization, and therapeutic exercise. Therapeutic exercise is often recommended for TMD, particularly in conjunction with manual therapy. The study aimed to conduct a systematic review and meta-analysis to evaluate the medium to long-term effectiveness of MT and TE for TMD. Methods: systematic review and meta-analysis. Information collected from PubMed, SoapPlus, Cochrane, SciELO, and Pedro databases. The keyword search were manual therapy, mandibular therapy, temporomandibular joint disorders, and joint disorders, TMJ and TMD. First screen for duplicates, relevance based on the title, followed by abstract full text settings with individualized assessment by two researchers and resolution of any disagreements by consensus. Inclusion criteria: RCTs only, participants with TMD. Treatments must include MT with at least one experimental group with or without TE. Minimum follow-up period 3 months. Pain as a primary or secondary outcome. Articles available in these languages. Exclusion criteria: neurological patients with a history of traumatic damage to their temporomandibular region. Studies focus on bruxism or sleep apnea. Methods: primary outcome, pain, used VAS. Secondary outcome, maximum mouth opening, range of motion, disability. Meta-analysis focused on TMJ outcomes of MT and TE for TMD. Main variables: effect size for pain change and MMO over time. Minimum 5 results needed for each variable for meta-analysis. Results: there were 262 articles reviewed, 135 removed, 6 only meeting the criteria. Pedro scale. Treatment varied. Therapeutic exercises were common. Cervical region treatment, TMJ neurodynamics, TMJ manipulation, injections, manual pressure, lateral and medial pterygoid muscle treatments, Michigan splints. Article findings: pain VAS and active MMO were measured in all studies. PPT in 2 studies, passive MMO in 2, and varied outcomes in others. Follow-up: 1 study had 4-month, 2 had 12-month, the rest had 3-month follow-ups. Significant pain and MMO improvement after MT for TMJ in all studies. Non-significant differences in pain and MMO at 3 to 6 months with MT and TE. Education. Compared to other therapies, MT showed the most significant pain reduction and MMO increase versus cervical manual therapy. No significant differences versus manual pressure on craniocervical centers or injections. Michigan splints showed similar results with better MMO when combined with MT and TE. Mean pain improvement around 4 to 10 immediately at 3 months. MMO improved by 15 mm post-intervention with varying maintenance at 3 months. Discussion. Manual therapy, with or without therapeutic exercise, effectively treats TMJ pain mouth opening limitation in the medium term. MT combined with TE shows better and longer lasting results compared to other therapies. Short-term pain reduction observed across all treatments. Medium-term pain relief maintained with TMJ focus MT, but effects diminish with cervical MT. Long-term pain reduction diminishes over time without therapeutic exercise. Short-term increase in mouth opening observed with MT and TE combinations. Michigan splints show medium-term benefits, but long-term uncertain. Conclusion. Manual therapy seems to be effective for TMD in the medium term, along with the effect appears to decrease over time. However, when compensated with therapeutic exercise, these effects can be maintained in the long term. Downside, the limited number of articles that met the criteria for current review. How could this research be used in the clinical setting? Knowing treatment duration helps optimize effectiveness, minimize risk, and ensure cost-effective care. There it is. And there's my resources.